let's turn to family history. If there's cancer in my family, should I have genetic testing?
So this is where it's really important with communication and to know your specific family history. There are certain syndromes, and so cancer genetic means that in your genetic code when you're born, you have a high risk of certain cancers if you have these certain changes in your genes or your chromosomes. A very common one that we talk about in gynecology is something called BRCA or BRCA, and that could mean that you actually have a gene that would put you at increased risk of breast cancer, ovarian cancer being the most common. So it'd be really important to know, which family members had what types of cancers. There's another type of cancer genetic syndrome in gynecology we think about sometimes called Lynch syndrome. That would be a little bit less obvious, but that would be, if you've had family members with uterine cancer, colon cancer actually is part of that syndrome. So it is important to know, which side of the family, and then, what ages that people had their different cancers in your family, because there are patients that meet criteria for testing early, which really changes how we screen and watch people.
So again, coming back to the theme that we often touch on, communication, and finding out understanding self, but also finding out that expanded self, which is your family, and how that could impact your health.
Right, exactly, because it makes a huge difference if we know that you're at risk, so we can be doing certain things sooner. For example, that BRCA or BRCA gene carrier, if we know that you have that, we start doing mammograms earlier. That involves breast MRIs, that involves, sooner pelvic exams, different testing to keep tabs on the ovary. So it really does make a huge difference what age we start things, and then what screenings we do, so that we can try to reduce your risk if we know that that's there and creating an elevated risk situation for you.
So communication and reaching out to the experts is key.